One of the biggest questions most women have as they navigate a miscarriage is why? Why did this happen? I know that was the one thing I kept asking over and over and over again during my miscarriage. I wanted answers so badly. And sadly, miscarriage is incredibly common. About 1 in 5 pregnancies end in miscarriage. Some care providers will say 1 in 4. It might even be more than that because a lot of miscarriages go unreported, as so many happen so early on, and a woman might mistake the miscarriage for a period. And usually they do happen in the first trimester, not all of them, of course, but most miscarriages occur in the first trimester. One of the main reasons miscarriages occur, 50 to 70% of miscarriages occur because of chromosomal abnormalities. And this is just a random thing that can happen. It in no way means that all of your future pregnancies or all of your future embryos will have chromosomal abnormalities. It's just something that happens, again, 50 to 70% of the time. That is the cause of the miscarriage. There's absolutely nothing that you did to cause that. And again, you will very likely go on to have a healthy pregnancy after that miscarriage if it's caused by those chromosomal abnormalities. There are also other contributing factors that can increase the risk of miscarriage. I do want you to know that it's highly unlikely that just one of these factors caused a miscarriage. Usually it's just a contributing factor. And of course, to learn more about these, ask your care provider. This is just a little brief look at some of the things that can increase the chance of miscarriage. So, infections like chickenpox, toxoplasmosis, which is caused by a parasite that you can be exposed to when eating undercooked meat that's contaminated or having exposure to cat feces that is contaminated. Listeriosis, which is a bacterial infection caused by exposure to listeria. Exposure to hazards like high levels of radiation or toxic agents can increase the risk of miscarriage. There are certain jobs that would potentially put you at risk for exposure more so than others. Dentistry, working in certain areas of a hospital, working in certain labs, factories, certain industrial jobs. If you feel that you have a job that puts you at a higher risk for exposure to toxic agents, talk to your employer about it. Ask them if they can assign you different tasks potentially that would lower your exposure. Hormonal issues, in some cases an overactive or underactive thyroid can cause an imbalance of hormones that might lead to the uterine lining not developing properly, which would make it hard for the embryo to properly implant. If you suspect that this might be an issue that you're contending with, ask your care provider to do a blood test, and they can test your hormone levels, and if anything is off, they can make recommendations on how to move forward. Uterine abnormalities can also be a contributing factor to miscarriage. Some women have something called a uterine septum, and this is essentially a wall of tissue in the uterus that splits it into 2 parts. Luckily, this can be removed during a surgery. Things like fibroids or polyps, which are non-cancerous growths, which can grow into the uterus, can also increase the risk of miscarriage. These can also be removed during surgery. An incompetent cervix. So this means that the cervix has trouble staying closed, often because of weakened cervical tissue. And if the care provider suspects that you have an incompetent cervix, they can provide medication, they can just closely watch you, or they can actually stitch up the cervix to keep it closed, and then they would remove those stitches right before you are ready to have the baby. Smoking, excessive chronic use of alcohol or illicit drugs could increase your chance of a miscarriage. However, don't feel that if you had a wild night before you found out you were pregnant, or you had a glass of wine here or there, and then you miscarried, it was highly unlikely that is what caused it. But just to be safe, most care providers do recommend that about 3 months before you start trying to conceive, you stop smoking, you stop drinking, and you talk to them about if there are any medications that you should stop using, if they're prescribed medications. Okay, autoimmune disorders like lupus or APS can contribute to a miscarriage. The big issue with these two autoimmune disorders is they can make it more likely for your blood to clot. And in some situations, a blood clot could impede the flow of blood to the placenta, which could pose an issue. Severe kidney disease, congenital heart disease, uncontrolled diabetes, thyroid disease, they could all increase the chance of miscarriage. However, if you are receiving really thorough, proper treatment from your care provider for any health issues you have, oftentimes it is possible to develop a healthy pregnancy, but you want to be getting proper treatment for whatever it is you're navigating. In very, very rare cases, group B strep could lead to a miscarriage. Group B strep is caused by a common, often harmless bacteria that can be found in the intestines or lower genital tract, and it just comes and goes naturally within the body. But again, that's very, very rare. There are certain medications that can increase the risk of miscarriage. Retinoids is one of these. They can be found in some skin serums, lotions, and the retinoid Accutane has been found to be especially dangerous. Methotrexate, that's a medication used to treat something like rheumatoid arthritis, can increase the risk of miscarriage, and non-steroidal anti-inflammatory drugs could also be potentially risky, and most care providers will ask you to not take those during pregnancy. But to receive a really thorough understanding of medications that are and are not safe during pregnancy, I would definitely check in with your care provider. Finally, if you're wondering if stress, exercise, or sex caused your miscarriage, it is highly, highly, highly unlikely that anything like that is what led to the miscarriage. So again, for more information about what potentially caused your miscarriage, have a long, thorough conversation with your care provider, keep asking questions, but also understand that they might just not be able to give you a conclusive reason why the miscarriage happened. And I know that is so incredibly frustrating, but again, a lot of times we just don't know for sure why it happened.